The majority of the men prefer to carry wallets in back pockets of their trousers. Some keep money and other documents like receipts, which keep increasing, thus bulging the wallets. Some of those with big wallets sit for long hours, like those that sit in offices and drivers. The bigger the wallet, the more the pressure it exerts on the muscle around the sciatic nerve, which is responsible for the movement of leg muscles. Dr. Stephen Emokol explains where the sciatic nerve is located.
The sciatic nerve gets its nerve roots right from the lower back, especially the last two nerve roots in the lumbar spine, and all through up to some nerve roots from the sacrum. Now all these nerve roots fuse together to form one long nerve, which is the sciatic nerve, that goes through your buttock area, behind your lower limb, that's behind your thigh, all the way down up to your foot.
Although it may take time for one to suffer the consequence of sitting on big wallets, these are symptoms of a sciatic nerve injury.
Pinched nerves usually present with burning sensation or pain that you actually cannot locate. Neuropathic pain it's more like pain that is deep-seated. It's just deep within the muscles. When you touch, you can't feel that, oh, maybe it's this part or it's this part paining. You just feel a pain radiating through that part of your body. And then also you may feel pins and needles, or what we call tingling sensations, or electric, sometimes it appears as electric shooting pain. So all these symptoms can also present when you have sciatic pain. Yes, because the sciatic nerve it's a nerve, so it will present with those symptoms. Yes.
So how long does it take to start feeling the impact?
It depends on the amount of pressure that is being put on the nerve. And it also depends also on the position of the wallet. If the wallet is more towards, more away from the buttock towards the side, it may not cause as much effect. But if you're sitting on it directly, then it's really going to pose a huge risk of acquiring this kind of pain. The body loves neutral postures, and the body is very settled when you're in a neutral posture, whether seated, sleeping, or standing. The moment you go away from a neutral posture, the body can handle that up to a certain period, and then that is when you start to feel fatigue and all these other symptoms that, yes, I need to change position. But the body loves neutral position. So when you sit on your wallet, your pelvis is going to tilt like this, and this can also lead you to getting chronic low back pain.
According to Dr. Emokol, the nerve is on both left and right buttocks.
It crosses through the inner half of the buttock area, going down behind your thigh until your foot.
The orthopedics further explains what you do once you have been diagnosed with sciatic nerve pain.
So when you discover that you have this kind of problem, first thing you always do is seek medical attention from an expert, from a specialist. This could be an orthopedic doctor or a physical therapist, or any doctor that is knowledgeable with this kind of symptoms. And the doctor usually may recommend physical therapy, which would actually help to reduce on the tension that is being caused on the sciatic nerve.
According to Dr. Emokol, 3 out of the 10 patients that visit their clinic daily, they present signs of sciatic nerve pain. And most of them, or majority, are always men. And when they interview them, they always share stories of how they've been sitting on big wallets, or even their car seats have challenges. And therefore, the doctors or the orthopedic doctors are calling upon everybody, especially the men who carry wallets, that please avoid sitting on your wallets, especially for quite too long. Sudhir Ruhanga, NTV.